What are the most researched psychedelic medicines? While there are dozens of different psychedelic medicines that need a lot of research, and we'll be discovering how they work in the mind and with treatment protocols, right now in the United States, there are three main psychedelics that have the most research. That's MDMA, also known as ecstasy, psilocybin, commonly known as magic mushrooms, and ketamine. Ketamine is an interesting one because it's used for anesthesia in hospitals, but it's also used for psychiatric purposes in lower doses. So in this video, I'm talking about the effects of the different medicines and their signatures, and how they increase creativity and connection to the people around us. Psilocybin, for example, may promote neuroplasticity, rewiring maladaptive thought patterns, while MDMA fosters empathy, trust, and emotional openness, aiding in trauma processing. Ketamine has rapid-acting antidepressant effects and has shown impressive efficacy in reducing suicidal ideation. But the impact doesn't stop there. Psychedelics have the potential to enhance interpersonal relationships. Psilocybin, for instance, has been reported to increase feelings of connection and empathy, fostering better communication and understanding between partners, friends, or family members. Psilocybin can inspire a profound feeling of connection to the natural world, and even induce mystical experiences that help people resolve feelings of uncertainty around our mortality. In fact, studies show that having a mystical experience actually improves the outcomes of psychedelic therapy. The mystical experience is a profound psychological mechanism influencing outcomes in psychedelic therapy. It includes features such as oceanic boundlessness, ego dissolution, and universal interconnectedness, which have been closely linked to both symptom reduction and improved quality of life. In the review, Psychedelics, Mystical Experience, and Therapeutic Efficacy, a systematic review, 12 studies of psychedelic therapy utilizing psilocybin, ayahuasca, or ketamine were analyzed for association between mystical experience and symptom reduction in areas as diverse as cancer-related distress, substance use disorder, and depressive disorders, to include treatment-resistant depression. 10 of the 12 established a significant association of correlation, mediation, and/or prediction. MDMA can promote emotional openness, reducing barriers and enabling individuals to explore and address relationship challenges within a safe and supportive environment, ultimately leading to healing and growth. Furthermore, the use of these substances has been linked to heightened creativity and problem-solving abilities. The altered states of consciousness induced by psilocybin, MDMA, and ketamine may unlock new perspectives, breaking free from rigid thought patterns and encouraging innovative thinking. By catalyzing novel cognitive connections and insights, psychedelics offer a unique avenue for individuals to explore their creativity and self-expression. When used mindfully and skillfully, these substances present transformative opportunities for personal growth, improved relationships, and expanded creative horizons. As therapists, we have a unique role to play in harnessing the potential of psychedelics for healing, connection, and creativity. MDMA classification is interesting because it's considered what's called a dirty drug, not meaning that it's bad, but meaning that it attaches to different receptors in the brain and not just the 5-HT2A receptor sites that we see with other classic psychedelics. MDMA is technically considered an empathogen, or sometimes it's called an entactogen, meaning it's sensual in its nature. More than hallucinations and visuals, we have a deep sense of love and connection and open-heartedness. And this is very distinct from other traditional psychedelics. MDMA's legal status is a little bit complicated. It's federally classified as a Schedule I substance, unfortunately, because Schedule I substances say that they have no therapeutic effects and they're highly addictive. That's absolutely not true with MDMA because loads of research prove otherwise, but it still remains Schedule 1. There's hope for rescheduling, but MDMA was just denied federal rescheduling in 2024. Even though the medicine itself lasts 4 to 6 hours in the therapy session, we see the acute effects for about 2 hours of the journey. The thing that's interesting and important to note about classic psychedelics, including MDMA, because MDMA also binds to those 5-HT2A receptors. In addition, it also binds to different receptors that produce oxytocin and vasopressin. But what we see is that there are medical restrictions. We can't have clients on other SSRIs or SNRIs, psychotropic medicines, when they take MDMA or psilocybin or LSD or other classic 5-HT2A binders, because that may cause what's called serotonin syndrome. It competes with those same binders. So clients need to titrate off of their SSRIs or SNRIs, and we work with their medical providers to help them titrate off of those medicines so they can be included in research studies. And when these medicines are rescheduled and we're allowed to use them in our practices, we'll want to work with their medical provider to make sure that they're not taking any medicines that will conflict with MDMA, psilocybin, and other medicines. Psilocybin is also known as magic mushrooms. It's a natural plant medicine, although it's actually a fungi, and it has a rich history of use by indigenous cultures worldwide. Every single continent for thousands of years has some tradition of using magic mushrooms. The therapeutic potential of mushrooms is incredible. It's been extensively studied for decades in its ability to treat conditions like treatment-resistant depression, anxiety, PTSD, and even the existential fear of dying. Many more applications for psilocybin are being discovered all the time in new research. Currently, psilocybin is not legal, but there is hope for rescheduling it in the upcoming years. As of 2025, Oregon and California are 2 states that allow trained facilitators to guide psychedelic-assisted therapy sessions. This is only on a statewide basis and is still federally illegal. Some states and cities have decriminalized the possession of psilocybin, such as states like Oregon and Colorado, and other cities like Santa Cruz and Oakland. Facilitators are finding workarounds to host journeys, but it's important to note that it is outside the scope of practice for psychotherapists to provide any medicine, any herb, vitamin, or any medicine to their clients. So it's currently out of the scope of practice for therapists. We can provide integration therapy, but we are not to provide the medicine itself. And currently, nowhere in the United States is psilocybin therapy covered by malpractice insurance for licensed clinicians. The effects of psilocybin last 6 to 8 hours, and the session is 8 to 10 hours, so it's a long day. The acute effects of the psilocybin come in waves. It's intense, and then it softens back, and then it's intense and softens back, and that lasts about 4 hours. Let's talk about ketamine. Ketamine and psychedelics. There's ongoing debate about whether ketamine qualifies as a true psychedelic. Robin Carhart Harris recently posted that ketamine is not psychedelic, but I would disagree. At the doses that we're talking about, if we go with Humphrey Osmond's definition of psychedelics as mind manifesting, I would say that at these lower doses, ketamine is absolutely psychedelic in that it is mind manifesting. It brings us incredible insights at those doses and helps us be able to observe our parts from that self energy, just like other psychedelics do. The origin of ketamine is interesting. It was invented in 1962 by Calvin Stevens, and it's been used for decades as an anesthesia in hospitals. It was coined a dissociative anesthetic by Calvin Stevens' wife, which is interesting because at the high doses that are used for anesthesia, of course, is a dissociative anesthetic. I don't find that it's a dissociative when it's used at lower doses because we can help the self observe the parts and have more clarity and awareness of traumas and different life events from the aspect of the witness instead of being in the story. There's a global recognition that ketamine is an essential medicine by the World Health Organization. And this is important, its legal status. It's currently the only federally legal psychedelic in the United States.
It's classified as a Schedule III medicine. Schedule III medicines are able to be prescribed by those with the Schedule III DEA license. That's important because psychotherapists must collaborate with a medical prescriber who holds a Schedule III license for its administration. Recently, the FDA recommended that a medical provider be present during ketamine administration, and the FDA opposes home use without medical supervision. The FDA may soon be restricting companies that are providing home use for lozenges. Something that's very important about ketamine is that it has medication compatibility. Clients can remain on their psychotropic medications like SSRIs and SNRIs and receive ketamine treatment. This is because ketamine binds differently than the classic psychedelics. So as I was saying with MDMA and psilocybin, those medicines bind primarily to the 5-HT2A receptors, the serotonergic receptor sites. Ketamine binds mostly to the NMDA receptor system. And this is important because clients that can't titrate off medicine cannot receive psychedelic therapy, but they can receive ketamine therapy. Something that I really appreciate about ketamine is its creativity and how we can customize our treatment protocols for each client. The effects of ketamine vary widely depending on the dose, higher doses versus low doses, and the route of administration. And so we can create unique dosing strategies for our clients while working with a medical provider to address exactly what they need. This offers incredible creativity and flexibility for clinicians and a very personalized treatment plan.